Hello, and welcome to the Skilled Assessor's Introduction to the Chicago Coordinated Entry System. My name is Justine Allenbach. I use she/her pronouns, and I am the Program Manager for our Coordinated Entry team at the Center for Housing and Health. I'll walk you through this Coordinated Entry introduction, and later in the training I will provide a demonstration on how to complete the Coordinated Entry Housing Assessment. At the Center, our Coordinated Entry Specialist is Chai McGill. Chai also uses she/her pronouns and is the point person for skilled assessors at the Center for Housing and Health. Here is a list of what we'll be covering in this presentation. Let's get started. The Chicago Coordinated Entry System was rolled out in 2017 in response to a federal mandate that all continuums of care, otherwise known as COCs, adopt a streamlined approach to prioritizing and distributing resources. The Chicago COC is comprised of more than 100 organizations and individuals who work together to prevent and end homelessness in Chicago. Representatives from each of these agencies work together to help support the implementation and refinement of the Coordinated Entry System in Chicago. CSH is the lead entity for CES. CSH stands for the Corporation for Supportive Housing. All Chicago is the HMIS administrator for the COC and manages data quality for the Coordinated Entry System in particular. Catholic Charities handles the matching and youth diversion for the Coordinated Entry System, and the Department of Family and Supportive Services manages diversion, drop-in, and shelter support. The Center for Housing and Health, the agency myself and Chai work for, is a co-lead to the Chicago Coordinated Entry System. Some of our responsibilities include outreach coordination, hosting the Chronic Singles SIT, which stands for System Integration Team Meeting, managing skilled assessors, access points, and more. Why CES? Coordinated entry is a front door approach for people experiencing homelessness to access housing and support. Before CES, the responsibility of finding housing was placed on people experiencing homelessness. With a coordinated entry system, there is one housing assessment that provides access to housing resources all over the city, so clients are not restricted to resources that are only close to their location, and they don't have to repeat their story for every application. This increases access to housing because referrals are not based on the preferences or contacts a case manager may have. In fact, clients don't even have to have a case manager to be assessed for CES. With CES, people get linked to resources that match their needs versus the first resource available. In short, a coordinated entry system ensures that our housing resources in Chicago are equitably distributed and that people experiencing homelessness who are the most vulnerable have access to our community's resources. CES matches to the following program models within our COC. Permanent Supportive Housing, PSH, which does not time out and includes supportive services and case management. PSH is generally looked upon as the highest level of housing support offered within our continuum of care. Rapid Rehousing, RRH. Rapid Rehousing does have a time limit, which varies by program, but generally has a 24-month maximum. Rapid Rehousing also includes supportive services and case management. Safe Havens. Safe havens have very limited availability in our continuum of care and are only intended to be used by individuals who cannot live independently. Transitional Housing, youth only. Transitional housing is available for youth aged 18 to 24 that move through the CES. Here is the CES workflow. The tasks you are responsible for as a skilled assessor are circled in red. I will explain each of these steps in this presentation. Engage. The first step of CES is engaging the target population. There are 4 avenues that people currently access CES. There are dedicated skilled assessors throughout the city that complete CE assessments full-time. There is also the Coordinated Entry CE call center, which is available to complete housing assessments over the phone. There are also some shelters, drop-in centers, and outreach teams who have skilled assessors on staff. Formerly, access points were used for in-person walk-in assessments. However, during the COVID-19 pandemic, access points have remained mostly closed, and clients have not been encouraged to visit access points in person and rather use the call center. During the COVID-19 pandemic, the opening of access points may happen at any point in time, so please stay in connection with the center's coordinated entry specialist, Chaim McGill, for updates about access points reopening. In your role as a skilled assessor, Chaim McGill will coordinate a variety of meetings and provide updates related to coordinated entry to all skilled assessors. The Coordinated Entry Call Center is managed by CSH and Catholic Charities. It has largely replaced access points during the COVID-19 pandemic. The call center is open Monday through Friday from 8:30 a.m. to 4 p.m. at 312-361-1707. Anyone who is eligible for coordinated entry can have the assessment completed or update their assessment using the call center. The next step of the CES workflow is assess. Before you assess someone, you need to verify that the person is eligible for CES. Here's why eligibility is so important. You don't want to waste your time and the client's time. It's better for the client to find out now rather than later if they're not eligible for coordinated entry. If the client is matched to a housing provider who learns that the person is not literally homeless, they will not move forward with housing the client. While time is being taken for the housing provider to interview this person, determine they are not eligible, and request another housing match, there is an empty unit that someone else could have had. Empty units could result in HUD providing less funding next time around because it looks like we don't need it as a continuum of care. So, who is eligible? Adults 25 years of age and older who are experiencing literal homelessness are eligible for coordinated entry, as well as youth aged 18 to 24 who are literally homeless or unstably housed. You can determine who is experiencing literal homelessness and therefore who is eligible for coordinated entry by asking, "Where did you sleep last night?" People who slept outside or in a shelter are always experiencing literal homelessness and can move forward with the CES assessment. Once you've determined the client is eligible, the first part of the assessment is completing the standardized housing assessment. It contains yours and the client's contact information, location, housing history, income, sheltered status, length of time homeless, and more. It is important to include detailed, updated contact information so that when the household is matched to a housing intervention, we are able to connect with them. The second part of the Coordinated Entry Housing Assessment is the VI Vulnerability Index and Disability portion. This covers any disability information for the client as well as their trauma history. When you finish the assessment, make sure the client knows to update their assessment at least every 90 days. Give them the CES client brochure or another handout you've created at your agency so they know their HMIS ID number and how to call in and do a coordinated entry system update or contact you to do so. Please also note triage. If the person is a veteran, a minor, fleeing domestic violence, or needs shelter tonight, please attempt to connect them to an immediate crisis resource. As a result of people entering clients into HMIS and skilled assessors completing coordinated entry housing assessments, a by name list is created from HMIS and includes information on all people currently experiencing literal homelessness in Chicago. This list is used by the Catholic Charities matching team for completing the matches for the coordinated entry system. Please also note that this is a by name registry, meaning it is not a waiting list. Matching. Catholic Charities, our matching team for the coordinated entry system, gets notified about a unit vacancy from a housing provider and then uses the by name list to match a household or individual that meets the opening's eligibility criteria and is the most vulnerable according to our system's current prioritization plan. There are a limited number of resources available for housing within our continuum of care. As a result, we must dedicate our resources to those who are the most vulnerable. Our community made the decision to prioritize those who are at a high risk of developing severe complications from COVID-19 as defined by the Center for Disease Control. High-risk households that are currently enrolled in a project are also prioritized above people not enrolled in any homelessness service program. You can find more information on the temporary COVID-19 prioritization plan on the Corporation for Supportive Housing's CES website. When someone you've assessed is matched to housing, you will receive an email from Catholic Charities. When you receive an email like this, you are responsible for reaching out to the client to let them know about the match and give them information to connect with the housing provider and housing system navigator if applicable. The email will also be sent to the housing provider the client is matched to and the housing system navigator. Housing system navigators help clients get documentation together and make appointments with the housing provider as needed. When you reply to the match email, make sure to hit Reply All. Skilled assessors should take an all-hands-on-deck approach to the matching email. Don't hesitate to reach out to everyone included in the email to assist in locating this client and ensuring that they are successfully housed. Please note that not all clients will be assigned a housing system navigator, as this resource is limited. Only clients who are matched to a permanent supportive housing PSH unit will be assigned a housing navigator if capacity allows. In cases where a navigator is not assigned, it can be especially helpful to connect the housing provider with this client if you are aware of the client's location. As of October 2021, the Chicago Coordinated Entry System adopted a 90-day inactivity policy, whereby clients will become inactive after 90 days if they have not updated their coordinated entry housing assessment. Updating the assessment only takes a few minutes and can be done via phone, email, or in person by any skilled assessor. The Coordinated Entry Call Center is particularly helpful for these updates. If you as a skilled assessor do not have capacity to update all of your clients every 90 days, do not forget that we have the call center. Skilled assessors have a variety of expectations upon them. As a skilled assessor, you are responsible for the following. You are responsible for keeping client information private and doing enough assessments to maintain familiarity with the system. You should also be completing assessments fully and accurately, and attending at least 2 trainings per year, as well as the skilled assessor quarterly meetings. Lastly, and perhaps most importantly, you should be providing high-quality care to each client you encounter. Being a skilled assessor is not an easy role, and we often encounter clients in a crisis situation. Please note that the Center for Housing and Health is more than willing to support you in those situations. If you feel lost for resources, do not hesitate to contact myself or Chaim McGill for support. For questions or feedback related to this training, skilled assessors, or other work facilitated by the Center for Housing and Health, you can email our Chicago CES@housingforhealth.org email address. Likewise, you can send comments and questions to Chaim McGill, our CES specialist. Thank you so much for listening to this beginning introduction of Chicago's Coordinated Entry System. In the next video, I will walk you through the Coordinated Entry Housing Assessment in HMIS. Thank you.